Good morning. Dr. Ken White has contributed to the advancement of the profession and the care and delivery of his community through outstanding leadership as a research, author, and clinician. Ken has excelled in a variety of diverse roles: scholar, practitioner, clinician, educator, and program administrator. He is currently the Associate Dean of Strategic Partnerships and Innovation at the University of Virginia School of Nursing. Throughout his career, he has directly improved health services and patient care delivery, especially to vulnerable populations. He became a registered nurse in 1995 and has volunteered at a number of clinics serving the poor. From 1999 to 2008, Ken has volunteered at the Crossover Clinic, and he co-founded the Centurion United Church Walk-In Clinic in Richmond, Virginia. Since 2009, he's been a volunteer camp nurse at Comfort Zone Camp in Richmond, and he's maintained his part-time practice as a palliative care nurse practitioner at the University of Virginia Medical Center. You can read more about Ken in your program, but here are a few of his accomplishments. Ken has served on a variety of roles early in his career, including hospital administrator and project team leader at Guam Memorial Hospital, while being employed at Mercy International Health Services. In 1993, he affiliated with VCU and worked for many years as the director of the graduate program in health administration, as well as received 2 endowed professorships, the Charles P. Caldwell Jr. Professor and the Centura Healthcare Professor. He is board certified in healthcare management as an ACHE Fellow since 1990, and he has a remarkable record of active leadership with ACHE going back to 1980, when he co-founded the Young Administrators of Central Oklahoma. He served as the Regent at Large for District 3 in 2002 to 2004, and in 2004 he was elected to a 3-year term on the ACHE Board of Governors. At that time, he was one of the earliest nurses and academics to serve on the ACHE Board of Governors. Ken also co-founded the Central Virginia Healthcare Executives Group in 2002 and served as the founding chair of ACHE LGBT Forum from 2016 to 2018. Frequently featured as a featured author of ACHE's Congress on Healthcare Leadership, Ken has brought a huge influence on many healthcare executive professional development, both as a mentor and as sponsoring hundreds of former students and colleagues for the advancement of fellowship status. Since 2008, he has taught the ACHE Board of Governors exam review course with consistently high ratings, and he's been a frequent presenter at ACHE's Congress on Healthcare Leadership. Healthcare leaders know him well, either from meeting him personally or from reading one of his publications. His groundbreaking book, The Well-Managed Healthcare Organization, now in its 9th edition, is commonly used in graduate healthcare management courses and is recommended for study preparation for the Board of Governors exam. In addition, Ken has received a 2012 James A. Hamilton Book of the Year Award for reaching excellence in healthcare management, which he co-authored with John Griffith. Ken has said that his stellar career and varied career in healthcare, it's never too late to decide you want to be a nurse, even if you enjoyed years of success as a senior healthcare executive. For his distinction in advancing healthcare excellence, the Board of Governors of the American College of Healthcare Executives is pleased to bestow on its 2019 Gold Medal Award upon Dr. Ken White. Ken, would you join me to the lectern, please?
Hello, everyone. Thank you, Michael. and thank you all for this cherished award, which is kind of like the Oscars and the Olympics of healthcare leadership. One big difference is that you know about this one in advance. So I don't have to fumble with the cards and cry and all that stuff at first. I've already done that when Deborah called me. I want to thank Bill Schoenhard, a former chair and a former gold medal recipient who nominated me for this award, and also for the supporters who wrote letters for this award, and that was Dean Dory Fontaine, my boss, and Terry Edwards, who works with Centera Health System, and Dr. Jim Begun. I am humbled by those who have received this in the past, and I'm also honored to be receiving the Gold Medal Award alongside my friend, Christine Candio. As an academic, I looked up the etymology of gold medal. It has its origin in the Olympics. Anyone who knows me well would know that I would not likely win a gold medal for a competitive sports event, unless it involved food or wine. So, I cobbled together a definition of the award that is more about recognition than competition. Pure gold is so soft, it can be molded with the hand and with the heart. Gold is a gift. Gold is compassion. Gold is a calling. Gold is something very precious. We all have gold within us. Metal is an alloy which provides the ability to support the gold. It is grit, tenacity, perseverance, and courage. Also something we all have. I wish to thank the following people in absentia who have mentored, supported, and affirmed the gold and the medal. First, I'm from Okmulgee, Oklahoma, rural northeastern Oklahoma. And the administrator in my junior high school, the administrator of the Okmulgee Memorial Hospital, started an explorer's post to introduce young people in high school and junior high school to the health professions, and he introduced me to hospital administration. It was a great career choice, has been a great career choice. To all faculty colleagues who have helped me be successful, like Dr. Dolores Clement, Dr. Steve Mick at VCU, and John Griffith at the University of Michigan, who took me on as his co-author in 1999, 20 years ago, for the 5th edition of the Well-Managed Healthcare Organization. Special thanks to the following who are in the audience. First, to Sister Julie Heyer. I met her in 1980 at my very first ACHE seminar on credentialing in Kansas City. As a friend and mentor, we have shared the sunny days as well as the rain, Julie, with a commitment to 40 years of annual FaceTime. She lives in California and I live in Virginia. To Dr. Jim Begun, the James Hamilton Professor at the University of Minnesota. He was my doctoral program director and dissertation chair at VCU, and now a trusted friend and colleague. Jim always believed in me and said yes when I asked him if I could go to nursing school while obtaining my PhD in healthcare management. I did it in reverse from Christine. I became a nurse after having been a hospital CEO at the age of 39, an NP at the age of 57. It is never too soon to become what you have always been. The best career decision, number one, was meeting Jim Begun. To Dean Dory Fontaine, Dory, who recruited me from VCU to be her associate dean at the University of Virginia and encouraged me to practice my bliss, which is palliative care. Dory has been the best boss I have ever had. Best career decision, number 2. To Deborah Bowen, our fabulous ACHE CEO in red, who saw the importance of expanding commitment to diversity and inclusion by giving a voice to all, and her full commitment to establishing a roadmap for the LGBT forum and other underrepresented groups. To all the students in my classrooms, programs, and ACHE seminars, in particular, I wish to mention a few that I have mentored who are here today. Carrie Owen Pleitz on the Board of Governors, Alan Cassee, who will receive the Hudgens Award tomorrow. He was one of my recruits and one of my students. Dr. Mark Diana, the chair of Tulane's Health Administration Program. Jerry Ibe, who was my student, and is now the MHA program director at the University of Oklahoma, where I obtained my MHA in 1980. To all the staff of ACHE and the Health Administration Press, especially Janet Davis, Cindy Hahn, C. Armstead, and Julie Nolan. And finally, to my family, who have traveled a great distance to be here today, Brenda, Teresa, Joan, Sister Julie, Jim, and the best personal award goes to my husband, Dr. Carl Uten, who loves and supports me no matter what. Each one of you has the gold and the medal. It is a privilege to have this great career where we can make a difference for our patients, families, and communities. Follow your bliss. I now hear the orchestra playing, and it's time to cut me off. Thanks, one and all.